Thrilled to be back. Great to be back in North Carolina.
Dr. Mandy Cohen, the current head of the Centers for Disease Control and Prevention and our state's top former public health official, is engaging the next crop of physicians at UNC's Medical Student Match Day. This is a time when these future doctors learn where they'll spend the next few years in residency in their specialty field.
Hello.
Before fueling those medical minds with inspiration, she talked to us in our studio.
At one time, you were in their shoes.
Yeah.
What made you want to do what they're hoping to do?
Oh, well, I was so lucky to see the field of medicine through my mom's eyes. She was a nurse practitioner in an emergency room. And what I saw, two things. One, I saw her be that caregiver in our community. People would stop her in the grocery store and say, "Thank you so much. You helped my mom, my sister, last night in the emergency room."
But the current CDC Director says the cracks in America's healthcare model stood out just as much.
But the other side I saw was the broken parts of the healthcare system, because she was in an emergency room. And so it gave me an appreciation both of how do you be that, trusted, caring person in someone's life when they're going through a hard time, but also how do you fix the system that I saw through her eyes that really wasn't working for everyone.
Earning the public's trust is as crucial as ever. Gallup News poll shows as of July 2023, faith in the American medical system sits at 34%.
Everyone should also get tested 1 to 2 days before gathering.
Cohen worked on the front lines of information warfare in North Carolina, using these public addresses during the COVID-19 pandemic to separate fact from fiction for families at home.
My time leading in North Carolina Health and Human Services for 3 years and then another 2 years during the COVID crisis was some of the most amazing, hard times of my career, and I've learned so much that I bring to the role as CDC Director. Importantly, it's about building a foundation of trust. And I take lessons like making sure we're being transparent, right? So we're communicating effectively.
Becoming a trusting and trusted messenger of sound health advice has been a lifelong dream for Wake Forest University medical student Jim Shadford Wooden.
Such a huge relief, so many mixed emotions, happiness, excitement. I'm excited to be back at Duke for my residency.
The National Center for Health Workforce Analysis projects a shortage of nearly 140,000 full-time physicians by 2036. Translation, a higher volume of compassionate, talented, and quality medical workers is needed.
I know it's going to be a big learning curve, and I'm just, ready.
Whether it's the opioid epidemic, working through a cyber attack on patient data collection, capping drug prices, or talking to folks across the country about vaccinations, Cohen believes there are plenty of opportunities for these new residents to lend a hand in the field of medicine.
These are hard careers, but we are so grateful, and it is so important and necessary. You have so many amazing moments laid out for you, and to say we need you. This country needs you.